Also, we have to assess the fluid status, and we can provide the patient with IV fluid based on the reading of central venous pressure. لأنه قلنا central venous pressure reading used to assess the fluid status. If this reading is low, we can provide the patient with IV fluid. If it is high, indicate hypervolemia or right ventricular dysfunction. Hemodynamic monitoring, including a low central venous pressure less than 8 to 10 mm mercury, low pulmonary artery diastolic pressure, and low pulmonary artery occlusive pressure, and should be less than 14 to 18 mm mercury, in a combination with a low cardiac index less than 2.5 liter per minute per meter squared. These hemodynamic values should be monitored and established. Monitoring post-operative infection. If fever persists more than 48 to 72 hours, the infection should be considered. We can provide the patient with antibiotic based on the result of culture بناء على نتيجة blood culture. Antibiotic that may be provided like cephalosporin and vancomycin. The length of the stay could be 4 to 7 days. We can provide teaching for the patient to avoid lifting heavy objects for the first 3 months after the operation. ما يحمل أشياء ثقيلة بعد العملية لمدة 3 شهور. Avoid strenuous arm movement. تجنب النشاط باستخدام اليد بشكل كبير أو الحركات الرياضية الشديدة. No driving 6 weeks after surgery. Resume sexual activity when patient can climb 2 flights of stairs without stopping. إنه يحاول يرجع للنشاط الجنسي إذا قدر يطلع شاحطين من الدرج من دون توقف ومن دون ما يظهر عليه علامات chest pain or shortness of breathing. Change position in the hospital frequently to avoid being side lying or prone position. So the change position is very important to promote the circulation. فما يضلوا على جنب واحد أو على نايم على بطنه، المهم يتحرك بأكثر من اتجاه. Inspect and clean the surgical incision using sterile technique and to avoid any infection, because infection at the surgical site post-op may lead or may need reopening in some cases. Follow dietary restriction, low salt diet, low fat diet, diabetic diet, and adhere to the medication required. Schedule follow-up appointment. نحدد موعد مراجعة للمريض بعد الخروج من المستشفى. The sign and symptom of infection that should be assessed. All of you know fever, redness, tenderness, drainage, swelling. And report palpitation, tachycardia, or irregular pulsation. These are signs and symptoms for infection. Seek follow-up if there are dizziness, fatigue, weight gain, edema, short breathing, and chest pain. These could indicate signs of ischemia, ischemic changes, graft failure that need urgent medical follow-up and treatment. Mediastinitis, which is a major infection among patients undergone CABG, التهاب في الميدياستاينم, could be devastating complication that increase the length of stay in the hospital. بزيد وجود المريض في المستشفى وبزيد المورتاليتي. The risk factor for mediastinitis: obesity, prior cardiac surgery, pre-existing type 1 diabetes, perioperative factors such as excessive electrocautery, transfusion of homologous blood, use of both internal mammary artery resulting in compromised blood flow to the chest wall. All of these factors may increase the risk of mediastinitis, which is the infection of the mediastinum. Pain: the common analgesic drug used are morphine, fentanyl, hydromorphone as needed. This drug can be supplemented with non-steroidal anti-inflammatory drug مثل ibuprofen, whatever, non-steroidal anti-inflammatory drug, such as ketorolac, toradol, which decrease pain through different mechanisms. Proven less restricted, less commonly used, لكن the most commonly used among patients post open heart is toradol. Caution should be used in administering non-steroidal for patients with compromised renal function اللي عنده defect في renal function لأنه non-steroidal بتقلل أو ممكن تعمل renal vasoconstriction decreasing the perfusion to the kidney, uh, may lead to renal failure, and also when platelet count are decreased, the state called thrombocytopenia. Patient controlled analgesia PCA pump can be used to allow patient to control the administration of pain medication. عبارة عن جهاز infusion pump بنركب عليها البين ميديكيشن ونخلي المريض هو اللي يتحكم في أخذ جرعة البين medication to control for the administration of pain after a specified and detailed teaching. The sign and symptom of infection that should be assessed, all of you know: fever, redness, tenderness, drainage, swelling, and report palpitation, tachycardia, or irregular pulsation. These are signs and symptoms for infection. Seek follow-up if there are dizziness, fatigue, weight gain, edema, short breathing, and chest pain. These could indicate signs of ischemia, ischemic changes, graft failure that need urgent medical follow-up and treatment. Change position in the hospital frequently to avoid being side-lying or prone position. So the change position is very important to promote the circulation. Hemodynamic monitoring including a low central venous pressure less than 8 to 10 mm mercury, low pulmonary artery diastolic pressure, and low pulmonary artery occlusive pressure, and should be less than 14 to 18 mm mercury in a combination with a low cardiac index less than 2.5 liter per minute. In the initial post-operative period, blood glucose level less than 180 mg per deciliter is very important for patient to control blood sugar and in order to enhance healing and prevent infection or mediastinitis. لأنه قبل شوي حكينا إنه the risk of mediastinitis increase among patients with diabetes, and especially among diabetes not well controlling their blood sugar levels.